So I want to ask this question back to Heather again. So again, from a nutritional standpoint, and it's just very interesting hearing your kind of take on things. Uh, what are kind of the tools when we think about kidney diet? What does that mean to you?
I typically approach patients I kind of simplify chronic disease in general as a form of inflammatory response that has been going on for years, right? So when you apply that concept to nutrition, you have to look at, is this food going to cause more inflammation, or is it going to cause less inflammation, right? So this is kind of gearing towards either being a more plant-based diet, getting off of processed foods, the manufactured foods. So I kind of explain it in that respect. So that once patients are at least on a cleaner diet, right, that inflammatory response should go down just slightly, okay? And then patients start feeling better. Then they're like, okay, what else can I do? You know, maybe it's the weight that comes off. Maybe their blood pressure goes down. Maybe they don't need as much insulin. Now, since they're feeling better, okay, let's incorporate some exercise in there, you know, just because the energy levels are up. So it's about taking it piece by piece. And again, I look at foods as is it going to make you inflamed or not? Okay, so I teach people that concept first. Okay, because yes, you can get into the healthful foods technically that have a lot of potassium, sodium that naturally occur, but typically the patients that are already at the chronic stage are already just eating processed foods. It's very rare that you hear that, oh yeah, no, I'm eating salads, I'm eating my share of vegetables, my share of fruits. It's very rare. When you really get into their diet, no, they're eating a lot of fast foods, things coming out of the packages. So when you have that conversation, and you slowly gear them towards, again, a better lifestyle, then they'll see some resolution in that inflammatory response.
That's I've seen personally, and a number of months ago I started to do this kind of clean eating resolution when I really got properly educated when I did my plant-based show, and my wife and I have been making this transition towards more plant-based eating. And I tell you what, when you think about anti-inflammatory foods versus foods that promote inflammation, I mean, there's no doubt the difference is night and day as far as how you feel once you stay consistent in those efforts. And I like how you said it, where you're doing more of the nutritional support little by little, and then layering on top of it, then the exercise components.
Yeah.
But I love how you're creating like this positive domino effect, because people will be reinforced to say, oh my gosh, I'm feeling great, I want to keep doing this more. And there's like this euphoria about that. And that can be applied across all sorts of health challenges. But as you're talking about now, again, talking about the things that affect the kidneys, I mean, the possibilities are endless.
Yeah.
So that's excellent. Dr. Fang, what's your approach when you think about kidney-related diets?
So I think there's, a lot of our patients have many other medical issues. They have heart failure, they have vascular disease, they have, on top of their kidney issues, they have dyslipidemia. So, and a lot of them are seniors, and I think that sometimes we make it too difficult for them, because they'll come into the office, they'll say, they've read online about the kidney diet, they've read online about the diabetes diet, the heart diet, the hypertension diet, and they're just overwhelmed with the things they have to do, and so I think sometimes they just not sure what to do. So I think that what both of you have alluded to is that it's actually probably much simpler than that, and that a more of a plant-based anti-inflammatory diet is good for all of those conditions, right? And so you can argue that one diet is good from a kidney function standpoint, promoting kidney health. It's good from a diabetic standpoint. It's good from a hypertension standpoint. It's good for promoting weight loss. It's good for everything that ails you, and it's good for preventing the things that could ail you. So the kidney diet, there probably really isn't a true kidney diet. There's different ways to define it. A kidney diet, basically, we generally apply this to people who have more significant kidney disease. And these are people who we might put on a slight protein restriction, or we might put on a mild potassium restriction. Not so much because those things prevent kidney disease, but because they help prevent some of the manifestations or the consequences of chronic kidney disease. So the focus is not so much on that, it's more on a healthy diet that is good for everything.
Excellent. Well, you said it great. And again, I think a lot of the shows that I've done so far on To Your Health with Dr. G have really centered around when we talk about some of the medical conditions, really centered around having that healthy foundation with nutrition. And now it's just a matter of, we can talk about it, of course, but it's a matter of just doing it. And we hope that as people continue to work with their healthcare team, but also their loved ones, and can find the reason why you do this. I had a gentleman on my show a few weeks ago who talked about, I wake up in the morning, I look at my daughter, and I go, and he says, you're the most absolute beautiful thing ever, and it makes him want to do more things. And so whatever kind of motivates you, whatever kind of passion you have, I want people to use that and apply to your health, but also apply that to your life. The things that are important to you are things that keep you moving, that make you want to say, hey, you know what, I'm going to put down that 100 calories of French fries and eat 100 calories of broccoli, or I'm going to go to the gym, or I'm going to put down that pop and drink more water to stay more properly hydrated. So there's so many different things. So I challenge people out there to say, hey, you know what, I don't want to get this kind of a disease. I don't want to kind of get these kind of challenges. And I don't want to necessarily have to visit Dr. Fang in the office. And there's no disrespect with that one because I've had a couple specialists where they'll say, I want to actually be put out of business if I can help stave off disease. But the reality is, we're still facing these rising epidemics, but as we continue to create more awareness and public engagement, we can continue to do much better. So what